The main STDs are chlamydia, gonorrhea, HIV, hepatitis, HPV, syphilis. You should always wear protection, right? But that just doesn't happen. The sexually transmitted disease may sound benign, but they can lead to a lot of problems. And why? Why do I know this? Is because those are some of the hardest surgeries to fix. Be honest with whoever it is, because technically that's assault, right? Because if you knowingly give a disease to somebody, I mean, technically that is assault. And I think we've read many cases where guys or girls can get themselves in trouble by knowing that they had the infection, but they purposely give it to their partner or whatnot.
We gon' do it like it's priceless. Take it to the moon. Priceless. One day will be soon. Like it's priceless.
Hey everyone, welcome to another episode of D-Talk with Dr. Pham. First of all, I just want to make a disclaimer. All the stuff that I talk about, this is my opinions and my knowledge. And so you will always have other doctors that may disagree. And so I try to keep the information as accurate as possible. And also, I want everyone to kind of know about what I'm talking about. But the reason why I don't go into too much details is I don't want people to try to self-diagnose and try to self-treat. What I'm trying to convey across is really symptoms to look out for, things to do to help live longer, healthier. But really, you need to follow up with your primary care doctor or a specialist or whatnot, depending on what the issues are. And so I had a listener who asked on Messenger, can I go into like really details? And I responded that the reason it's by design is I don't want to go too much into details, because next thing you know, what's going to happen is people are going to self-diagnose and end up doing things that maybe they shouldn't be doing. So, I try to keep it kind of just general, but specific enough so that you know the questions to ask your physician or your nutritionist or whatever the topic may be, okay? And then of course I try to make the show a little fun, just because what I do is a very sensitive topic, even though it's 2024 where it seems like nothing is really taboo anymore, but really a lot of men's health stuff really is still taboo. And so my goal is to try to make it as less taboo as possible. And one way I do that is try to put a little humor into it to kind of build rapport, and then from there the listener kind of can connect, and that's my goal. Okay, so I just want to put that disclaimer out. Everyone knows how this works. I pick topics based on random people asking me to go over certain things, and if it's a topic I'm not a professional at, or at least have adequate knowledge, such as, like, let's say prostate cancer, then I would bring in a someone who knows a little bit more. For instance, like one of my partner who does a lot of prostate cancer, so I would bring him in. But for some reason, my partners are very shy in front of the cameras. I don't know why. I told them there's really not a live audience, but both of them declined just because they're shy of the camera, and which to me doesn't make sense, because you see patients every day, right? So why are you guys shy? Well, today we're going to talk about sexually transmitted disease, and there's a lot of nuances to it, because any disease that can spread through sexual intercourse is considered a STD or an STI, depending on how you use the word. Okay, so STI, you'll hear some physicians refer to sexually transmitted disease or bacteria and virus as sexually transmitted infection, which is correct. Sexually transmitted disease is also correct. So the nomenclature really doesn't matter. The key here is sexually transmitted disease is what I will be using. But if you hear your doctor using STIs, or if you read something that says STIs, what they're referring to is really the same thing. Now you can break it down, well, STI is really the infection, the STD is really the disease itself. So yeah, there is subtle differences, but for the purpose of the podcast, when I'm saying STDs, I'm really referring to the infection as well as the result of the infection causing the disease. So what do I mean by that? Well, gonorrhea is a sexually transmitted infection. Now, once you get the gonorrhea, it can cause symptoms such as discharge, burning, pain, and then long term, it can cause strictures. Then that will then now become STDs, which is sexually transmitted disease, because now that's the clinical symptom is the disease itself. The infection is just the bacteria. But to keep it kind of simple and not confuse listeners, I'm just going to refer to it as STDs. Okay. Well, let's talk about STDs. So the main STDs are chlamydia, the ones that we see anyways, but generally the main ones you're going to see is chlamydia, gonorrhea, HIV, hepatitis, HPV, syphilis. So those are really your kind of your main ones. And so we're going to touch really on chlamydia, gonorrhea, syphilis, and HIV. And, there are, other sexually transmitted infection, but those are going to be your big ones. But usually, how does it present? Well, typically it presents the same way in males and females, with certain exception. And one of those would be like chlamydia. Some guys may not actually have symptoms of chlamydia, so they may not even know that they're actually passing it on. Versus typically in females with chlamydia, they will kind of have symptoms, discharge, pain, whatnot. And so the symptoms, unfortunately, is just the clinical outcome of an infection. And what do I mean by that? Well, you can also have a urinary tract infection, which can be E. coli, can be Staph aureus. There's just a host of bacteria. Pretty much any bacteria can cause a urinary tract infection. Sexually transmitted infection should really be a subcategory of overall infection. Okay. So we're gonna have an episode where I will be focusing on kind of recurrent urinary tract infections. This episode, we're gonna focus on sexually transmitted disease, and the big ones are the ones that I just mentioned. Now, like I said, in guys and girls, or males and females, they present in terms of symptoms kind of similar. But since this is really kind of focused a little bit on guys, then I'll kind of go with the symptoms that present in guys. But the symptoms is always going to be the same for any infection, generally speaking. And that will be blood in the urine, and it can be either microscopic, which means that you can't see it, but when they test you for it, it's positive for blood. Now, you can eat fruits and vegetables that can cause a false positive on that urine analysis that you get checked in the doctor's office. So typically, what you do is that needs to be sent to the lab where they do what we call a formal urine analysis, where they're actually counting the blood. So they're seeing the blood cells. Now, it can also be macroscopic or gross hematuria. And hematuria is just a medical term for blood in the urine. And so when we when I refer to gross, I'm talking about you physically can see the blood. And that's going to become important because a lot of urologic diseases present as blood in the urine, not just infection. Cancer, obstruction, stones, you name it. Okay. And so that's why when you interpret these tests, you kind of have to interpret it as a whole. Okay. So, but let's talk about sexually transmitted diseases for a second. So, the most common ones are the ones that I've listed previously. And also, those are the ones that the laboratory is supposed to report to the state to know so that the state can document, if there's a potential outbreak or whatever it may be. But the other bigger problem is who did you get it from or who did you give it to? And so, what I mean by that is, let's say a guy comes in and he's complaining, hey, Dr. Pham, when I'm urinating, I'm seeing blood. I'm 23. I'm not a smoker. This happened 2 days ago. I don't really have any fever, but it really stings a lot. I have this kind of smell. And bear in mind, smell is not a good indicator of an infection, okay? Because depending on the food you eat, you can get the urine smell to be different. And so don't use urine smell as a reliable factor for an infection. And so then he may also complain of some discharge, and it may be green, yellow, white, clear. It doesn't matter. The key here is he sexually active? Usually the answer is yes. And was he wearing protection? Usually the answer is no. And now, of course, all you can do is rely on what the patients tell you, right? But I can tell you some patients are embarrassed, so they may not tell you the whole truth. But in the end, it really doesn't matter because what you're trying to do is build rapport with the patient so that they know that you're really here just to help you. Or, like for me anyways, I build rapport with the patient just to let them know that I'm really here just to help you. But if you have chlamydia, gonorrhea, syphilis, HIV, I think those, and possibly hepatitis, I have to double check on that. But I think those need to be reported. And then also your partner, they, really, you should tell them about it, and then they need to be tested so that they can be treated. Otherwise, you're going to have this vicious cycle where basically you're going to have an infection that will run rampant. And so I read an article a couple weeks ago. I can't remember where in the U.S., but they're looking at they're seeing kind of an uptick in these sexually transmitted disease. And when they're referring to sexually transmitted disease in general on the news, they're not talking about E. coli and stuff. What they're talking about is really the syphilis, the chlamydia, the gonorrhea, and the HIV and stuff like that. Syphilis is a little bit rare just because it's easy to treat, and we pretty much almost eliminated it. But it can come back. And keep in mind, the list I just gave you is not a very full list. If you want to know a full list, you can just Google it. They'll give you a full list of all the bacteria or virus that can be transmitted sexually. And so just like monkeypox, right? And so bear in mind, kind of what I said in the very beginning is really what I want the audience to get out of this is the symptoms, get it checked out, get it treated, and then make sure your partners get treated. And that's very important. Now, it is a very tough topic to talk about, and I'll give you a funny story. Well, it wasn't funny to the patient anyways. So I had a patient that came to see me for, male problems. And so I requested medical records, and it took a while to get it, but we were finally able to get the medical record and all that. So then on there, when I had first met him, he was with his girlfriend or fiance, something along that line. I really didn't get into details with that. I kind of just kind of introduced myself, and then they introduced themselves. And it's been a while. I can't remember. Was it the girlfriend, the wife, the fiance? But point being is somebody that he's been with for a while. So I asked him, do you have any medical problems? And he's a young guy, 30s. He had like high cholesterol, which who doesn't have, right? Even I have that. But other than that, healthy guy, no issues, anything like that. And he didn't come in because of sexually transmitted disease or any sort of penile discharge or anything like that. And so I took a history like everyone should, what's your other medical problem? Have you ever had surgeries? This and that. And then we talked about his issues and we come up with a plan together and then we carry out that plan. Well, in this patient, I didn't want to order all these labs if he recently got it ordered by his primary care doctor because, yes, could I just give him a lab sheet and, and just get it done? Yes, but let's try to, save a few dollars in healthcare. And so I told him, I said, I'll tell you what, before I order any tests, let me request the records because he couldn't remember what test was done and who does, right? When you come in there, it's like the minute you see the needle, everything goes out the door. You're kind of like for me anyways, I'm just like looking the other way. I'm like, is it done? Is it done? And then I look over and I see like it looks like a dinner party for a vampire. It's like 5 or 6 vials of blood over there. I'm like, I'm like, am I gonna be able to make it? And they'll be like, you'll be fine. So anyway, finally the records come. So I called him and, he was in his car and I asked him, I said, is this a good time to talk? And he said, yes. And so I said, hey, last time I talked to you, I asked you some questions but I'm looking at your note here and it has a medication on here that's used to treat a sexually transmitted disease. And so I asked them, like, did your doctor ever tell you about this? Or is this, because sometimes it could be not the right accurate information, right? And so I got to confirm with them. And so, and we confirmed with the primary care doctor that, yes, this is his records. And yes, he did have this because I didn't get that information when I first saw the patient. And so he was in his car, but I didn't know his, girlfriend or fiance was in the car with him. It was just on speakerphone. And so he didn't tell me anything. I just asked him, like, is this a good time to talk? And he said, yes. And so I just told him, I said, I wanted him just to be aware of it. And so that once he got treated or while he's getting treated, like I want to know, did the other partner get treated? And so I asked him, I said, hey, on your medical record, I'm seeing that it's saying you're having this. And you didn't tell me that last time. And he said, no, I don't remember having that. And I said, are you positive? Because I called your doctor or my office called, the primary care doctor and they confirmed, yeah, the patient was treated with this and so forth, so on. And so I said, because if this is not you, then I need, then they need to purge that from the medical record because that can become a big deal for whatever reason, life insurance, whatever, you name it. And so he's like, no, I'm pretty positive. And I said, so I read out the name of the medication. I said, does this sound familiar at all? He's like, nope, that doesn't sound familiar at all. And I said, are you positive? He said, yes, I am very positive. I said, okay, this doesn't make sense because he had came back to see the primary care doctor multiple times for the same thing. And so I said, I named the the bacteria and the disease itself, and I said, basically, does any of these names sound familiar to you at all? And he said no. And so I was like, huh, something just doesn't make sense, because that could explain his symptoms. And that's the reason why I it was critical that I know about this. And so finally, he said, I said, okay, are you sure? Because it's saying that you're getting treated like right now. And he's like, no, no. And I said, okay. And then he said, well, yeah, maybe it did sound familiar. I said, okay. And so I told him, I said, listen, I'm just really here to help you. But if you're not honest with me, I won't be able to help you because I'll be chasing down a rabbit hole. And so he said, no, I understand, doctor. And so, well, that's when it dawned on me. I said, wait a minute, are you in the car with someone right now? He said, yes. And like I said, I can't remember if it was his fiance, but let's just say it's his fiance. He said, yeah, I'm in the car with my fiance. And I was like, oh, that is the worst thing that can happen. So I asked him, I said, well, does she know about all this? Because she's going to need to get treatment herself. And it's one of those disease that is a virus that's not going to go away, i.e., we don't really have a cure for it. We only have medication to keep it at bay. And then he told me, well, she does now. And I went, oh my God, my heart just sank. And then he just said, Dr. Pham, can I talk to you later? I said, absolutely. I said, just call me when you are ready. And so he reached out to me, I think, a couple days later, and I felt really bad for the guy. And he actually apologized and said, I'm so sorry, Dr. Fran, to put you in that position. I should have been kind of upfront and all that. And I said, no, I said, listen, I've seen it all, I've heard it all. I'm really here just to help you. And I hope that whatever it is that transpired will kind of, they're going to work this out. And so my point of that story is, if you do have a disease or an infection that is sexually transmitted, the right thing to do is get tested, obviously. And if it's positive, you really got to let the partners know. Because if that partner doesn't know, and it doesn't have symptoms, then we got a problem because now you're going to be spreading this. Now, I've never reported to the state because I think the laboratory reports it, something like that. Or my office reports it. I'm not sure, to be honest with you, because I deal mainly with children, and so my adult partners would know better on kind of what you do for that. And I don't know what the state does with the data. Like, do they use it just to track, or do they actually reach out to the patient themselves to try to make sure that whoever he came in contact with gets adequately treated. And so that's my point about this episode, is that you should always wear protection, right? But that just doesn't happen. And the sexually transmitted disease may sound benign, but they can lead to a lot of problems. And why? Why do I know this? Is because those are some of the hardest surgeries to fix. Okay, so let's break them down, the big ones. Well, HIV, that's very simple. From a urologic standpoint, the only time HIV kind of comes into play with us is if you have a stone that is made up by, kind of clumps of the medication, the medication causing like clumps, and it can obstruct your ureter. And so for those on HIV medication, now the newer ones, I don't has that, but just bear in mind that those are stones that you really need a CAT scan to be able to kind of see, because a chest, an X-ray is not going to find it, and it's like this gelatinous stuff. And so that's kind of the only time that HIV kind of can cause a urologic symptom. The other ones are syphilis that can cause, secondary and tertiary issues that, that can lead to urologic issues. Chlamydia, typically, a lot of time is actually there's no symptoms in guys, so you don't even know that you have it, and it's easily treated with doxycycline, or there's other antibiotics that you can use for that. But the big one I want to talk about is the gonorrhea. So typically when a guy comes in that's sexually active and has symptoms, we empirically get it tested. Now they can get it tested now without actually having to put a probe inside the meatus, which is what all guys hate. You can actually just urinate into a cup now, and they can test for gonorrhea and chlamydia, which is the big two that we test for. We don't routinely test for HIV and syphilis and stuff like that. And then basically we get them tested, and then we empirically treat them. And usually for the treatment, we just give them one dose of ceftriaxone and then a few days worth of doxycycline, and that'll cover the treatment for chlamydia and gonorrhea. And normally any adult practice will have it, whether your family practice, internal medicine, urology, doesn't matter, because sexually transmitted disease is not uncommon. But gonorrhea is one of those that actually can lead to long-term side effects. And what I mean about that. So gonorrhea infection, even though it's treated, in some guys, it can cause scarring in the urethra, where it will basically block the flow of urination. And if you block the flow of urination, it will back up, and eventually it can back up to your kidney. And, the kidney, unlike the liver, cannot regenerate itself. And so once you have so much pressure that it backs up, you can actually destroy your kidneys. And so gonorrhea is not as benign as what people think it is, where, if I get it, I just need to go get a shot of 1 gram of ceftriaxone and then we're done. That it's not that simple. Fortunately, it doesn't occur often, but for those that it occurs, it can be pretty tricky to treat, because a lot of times you may not be able to just go in there with a scope and just cut out the scar. You literally have to, like when I fixed these, I remember there was one, I can't remember, he had skip lesions, so there was multiple scarred area. And the penis, or the urethra, is divided into 5 different sections. And I think that's more important for surgical planning. And so with this guy, he had this scar, and basically I had to cut out all the scar. But then now you got to have a replacement, right? Because if you have a tube and you cut out a bad part of the tube, well, where are you going to put that in? So mouth tissue. So believe it or not, the buccal mucosa, or the labial mucosa, which is this, buccal mucosa is on the side of your mouth. It's unlimited. It's similar to urethral tissue, and it will always grow back. And it's just amazing to me, what you can actually do with the tissue in your mouth, because we have used it as ureter. So there was a patient we operated on that she underwent 5 previous kidney surgery, and there was just no way to reconnect her ureter after we cut out the scarred ureter. So you only have 3 options at that point. One is cut out the kidney, take out the kidney. Well, you don't want to do that. It's a perfectly good kidney. She's young. Second option is use a piece of bowel to connect the ureter from the kidney side to the ureter from the bladder side. Well, anytime you do bowel work, your morbidity is going to be, or complication rate is going to be around 50%. And so that's better than having your kidneys out. But that's not fun either. So the third option, which is what we went with, which is I just harvested some tissue from the mouth. My partner just measured out, robotically, while, how many centimeter he needs. And then, especially in an adult, you can harvest a lot of buccal mucosa on the left. Then you also have on the right. Then you also have the labia on your lip on the bottom, and then you have labia on top. So you can get pretty long. You can't make a penis out of it, but you can. I use mouth tissue to make urethra, and so that's what we ended up doing for this guy. Is we ended up having to use mouth tissue, and once we cut out the scar, well, I can tell you that he's doing fine now. Obviously, it's been a couple years, but I asked him, "Do you use protection now?" He goes, "Oh Lord," he goes, "I put on 3 of those magnums," and I said, "Well, just to put a little humor in him, because he underwent major surgery." And I said, "Are you sure they were magnums, or you misread them?" So he's like, "No, I'm pretty positive it was Magnum." No, the guy was pretty long, so it probably was Magnum. But he's like, "No, I triple put it on there." And then, just real quick on the condom, the latex condom is probably the best. If they also have like other material that they use to make condoms. The problem is some of them, I think it's made out of sheepskin or sheep intestine or something like that, goat or something like that. And that one is, it blocks certain infection, but it doesn't block all infection. Okay, so I hope you guys find this helpful. But the main thing is, just to let me summarize, if you come in for a evaluation because of a possible infection, then you need to do a urine analysis. This is going to be your algorithm here. And basically, from that urine analysis, you can decide to send it for a culture or not. But that's more on the infection with not sexually transmitted infection. So that would be like E. coli, whatever it may be, right? And so in guys that are sexually active, I also, aside from testing for a urine culture, which is we're just testing for non-sexually transmitted bacteria, we also test for sexually transmitted bacteria. And with that, there's no quick lab that I can run in the office. We just send you downstairs to a Quest lab or whatnot. And then once you give the sample, now here's the trick. A lot of guys, for the urinary tract infection anyways, if you send, because they don't, and for the sexually transmitted infection, you don't have to swab anymore. The trick is a lot of times guys actually don't know how to give the urine sample appropriately. And so the best way to get the urine sample is through catheterization, but obviously guys are not going to like that. And another way is to do a suprapubic tap, where basically kind of where you kind of right below your belly button where your bladder is, you can actually put a needle in there. We use ultrasound guided to get it, and so that's the most sterile you can get. Well, obviously that's not going to be feasible, right? And so the easiest way is just to urinate. And in children, they just put a little bag on there. And but the proper way is, what you do is you clean. If you're circumcised, then just clean the glans penis or the head of the penis. If you're uncircumcised, pull it back, clean everything. And what I do is the 1 second rule, where basically I have the guy go ahead and urinate and then count 1,000, but not like 1,000, okay? Like 1,000. Then you put the cup in, and then that's how you appropriately give a sample. Otherwise, you can get contamination. And then for guys, typically that are sexually active and the symptoms kind of match possible sexually transmitted infection, then we give a dose of 1 gram of ceftriaxone and then doxycycline. And then if you're allergic to those, then there's other stuff we can do. But that's kind of your mainstay of treatment. And the second thing is to be honest with whoever it is, because technically that's assault, right? Because if you knowingly give a disease to somebody, I mean, technically that is assault. And I think we've read many cases where, guys or girls can get themselves in trouble by knowing that they had the infection, but they purposely try to give it to their partner or whatnot, And so, anyways, like I said, the point I just want to get across is how you figure out the symptoms. The doctors are really there to help you. Get it tested. And then basically, now if they test you and then you have blood, then they'll retest you in about 6 weeks to make sure you don't have blood. Because you still have blood, then that's a whole totally different workup. But anyways, then make sure your partners get treated if the culture does come back positive. And I'm a big believer in trust, right? So if you have a long-term partner, you definitely you should notify her. But even if it's a one-night fling, whatever it may be, just to prevent kind of that outbreak, I think is a good idea to treat the partner also. And some doctors will even call in a prescription for the other partner. But I think that's really, kind of, physician to physician. But I think the key is the patient just needs to take control of the situation. We can help you diagnose it and treat it. It's your job really to tell your spouse or whatnot about it. And I'm not going to go into that. I'm not a therapist. So, but anyways, I hope you guys find that helpful on sexually transmitted disease. And obviously, click the subscribe button so that I can continue to do more episodes. So to kind of help you guys, not just guys, but just help people in general recognize certain symptoms, get it treated before it becomes late and then becomes something bad. All right. Well, thanks for tuning in on another episode of D-Talk with Dr. Pham. So until next time.
Let it's priceless. Take it to the moon. Priceless. One day will be soon. When it's price.